Let's talk a little bit about flu and Tdap vaccines during pregnancy. What other vaccinations are recommended during pregnancy and why?
Yeah, so as we talked about, flu vaccine, when flu season comes, October, November, December, we are going to be all about vaccinating women against flu. And the reason is that, we've seen during multiple pandemics, epidemics, you name it, and every year, actually, there are flu deaths. And the likelihood of dying from flu is higher if you're pregnant. If you think about it, there's, sort of the physiologic changes of pregnancy just make it harder to clear flu, and people do very poorly. So we will sort of recommend for all of our patients, the minute the flu vaccine is available, that they go ahead and get vaccinated. Tons of safety data on flu vaccine during pregnancy, not associated with miscarriage, birth defects, you name it. So that would be number one. The second one that we suggest for all women is Tdap, which is tetanus pertussis, but really we're recommending it because we want to protect your baby against pertussis, which is the same thing as whooping cough. And there are random outbreaks of whooping cough. We know that children less than the age of 1 are at an increased risk for dying from whooping cough. And so it's super important for women to get vaccinated. And we've had the experience back in the early 2000s, we had the experience of trying to vaccinate mom, sister, grandma, partner, try and do this, sort of cocooning of the baby and try and, protect everybody. And honestly, that didn't work that well unless mom was vaccinated and actually transmitting those antibodies directly to the baby. So again, super important for newborns. The other thing I would say about flu vaccine, which I think I said earlier, is that an added benefit of the flu vaccine is we know that those antibodies are transmitted to babies and will protect the babies for the first 6 months of life while they're waiting to, while they're exposed to absolutely everybody and can't get vaccinated. So those are the two most common things that we recommend.